It is a Saturday morning in July. You are at the beach, or a backyard pool, or a park. You shake the bottle, squeeze a line of white cream into your palm, and rub it into your child's shoulders before they run off into the sun. You do this because you love them, because skin cancer is real, because every pediatrician, every dermatologist, every health authority on the planet agrees that sun protection matters. You do not read the ingredient list on the back of that bottle. Nobody does. It is 12 words long, they are all spelled like chemistry homework, and you are already late getting to the pool. This video is about one of those words. One specific chemical that appears in the majority of chemical sunscreens sold in the United States today. I am not going to tell you to stop using sunscreen. Skin cancer kills people, and sun protection genuinely saves lives, and I want to be unambiguous about that from the first sentence. What I am going to show you is something the FDA itself published, something that changes how you read that label, and something you can act on in the next 60 seconds. Keep watching. The chemical is called oxybenzone. You will find it listed as benzophenone 3 on some labels. It is the active UV-blocking ingredient in a large proportion of chemical sunscreens available at every pharmacy, grocery store, and big box retailer in America. Here is what the FDA found when they studied it. In 2019, the agency conducted clinical testing on 6 common sunscreen ingredients, including oxybenzone. They were measuring how much of each chemical crossed the skin barrier and entered the bloodstream under real-world application conditions. Not extreme lab conditions. Normal use. Apply once. Go outside. The FDA found that oxybenzone, along with 5 other chemical filters they tested, was absorbed through the skin and detected in blood after a single application. The concentration reached levels above 0.5 nanograms per milliliter. That number matters because 0.5 nanograms per milliliter is the FDA's own threshold, the level at which the agency says further safety studies are needed to determine whether systemic exposure poses a risk. The FDA's own study, using normal application, found that the chemical was crossing into the bloodstream above the agency's own safety threshold after one use. Oxybenzone is not just a chemical that enters the blood. It is a chemical that, once inside the body, does something specific that distinguishes it from most of the other compounds we have covered in this series. It behaves like estrogen. A 2023 review published in a peer-reviewed environmental health journal examined 254 separate studies on oxybenzone and reached a clear conclusion. There is mounting evidence that oxybenzone has endocrine-disrupting properties under the conditions of normal sunscreen application. The review identified the most concerning consequence as potential reproductive problems, specifically because oxybenzone can interact with the same receptors that the body uses to respond to its own naturally produced estrogen. A 2025 comprehensive review covering 10 years of research on sunscreen UV filters confirmed the earlier findings and added specific concern about harm to the developing fetus and effects on pubertal outcomes in children. A separate study published this year examined the specific overlap between oxybenzone exposure and polycystic ovary syndrome pathophysiology, identifying estrogenic activity, interference with steroidogenic enzymes, modulation of thyroid hormone, and disrupted folliculogenesis as mechanistic overlaps. These are not fringe publications. These are peer-reviewed research appearing in established environmental health and toxicology journals throughout 2025 and into 2026. I want to be precise about what this does and does not establish. Animal models and in vitro studies form the bulk of this evidence. There are no controlled human trials conclusively demonstrating that normal sunscreen use causes endocrine disruption at the population level. What exists is a consistent, growing, and independently replicated body of laboratory and observational evidence pointing toward a plausible biological mechanism that the FDA has formally acknowledged requires further investigation. Here's the question that follows naturally, and it deserves a direct answer. If the FDA's own research flagged oxybenzone as absorbing into blood above its safety threshold in 2019, why is it still the active ingredient in the majority of chemical sunscreens sold in the United States right now in 2026? The answer involves a regulatory structure that has not kept pace with the science, and a market dynamic that has not had sufficient pressure to change. In 2019, after their absorption study, the FDA proposed updating sunscreen safety regulations to require additional data from manufacturers on any ingredient absorbing above that 0.5 nanogram threshold. Manufacturers were required to submit safety data, Most did not. The regulatory process stalled. Oxybenzone continued to be sold while the data that would resolve the safety question was never fully submitted. Simultaneously, the global regulatory picture diverged sharply. The European Union implemented significantly stricter standards for sunscreen ingredients, which effectively removed or restricted oxybenzone from most European formulations years ago. Hawaii became the first U.S. jurisdiction to ban the sale of oxybenzone-containing sunscreens, citing documented environmental harm to coral reefs in addition to the human health questions. Several other coastal jurisdictions followed. The global scientific consensus moved. The U.S. market largely did not. The biological mechanism behind oxybenzone's estrogen-like behavior is worth understanding because it explains why researchers keep finding it in the same categories of concern that show up with other endocrine disruptors we have covered in this series. Oxybenzone belongs to a class of compounds called benzophenones. These molecules are small enough and lipid-soluble enough to cross cell membranes with relative ease, which is why they absorb through the skin rather than sitting on the surface the way mineral filters like zinc oxide do. Once inside the body, oxybenzone has been shown in laboratory models to bind to estrogen receptors and activate them, producing a biological response that mimics the effect of the body's own estrogen. In animal studies, oxybenzone exposure at concentrations overlapping with human peak plasma levels produced prolonged estrous cycles, changes in uterine estrogen receptor gene expression, endometrial hyperplasia, and altered mammary gland development. In separate in vitro studies using human sperm cells, oxybenzone at concentrations found in human blood samples caused sperm cell dysfunction. A 2025 comprehensive review identified accumulation of oxybenzone and its metabolite in thyroid, adrenal, and thymus tissue in animal models. The thyroid finding is notable because thyroid disruption is one of the harder to detect consequences of endocrine disruption at the population level, affecting metabolism, energy regulation, and developmental trajectories in ways that do not produce a single dramatic clinical signal. None of this means that one day at the beach with standard sunscreen has a measurable health consequence. Dose and duration matter enormously in toxicology, and the gap between animal exposure concentrations and typical human exposure concentrations in normal use is a legitimate scientific consideration. It means that the biological mechanism exists, has been independently replicated, and is operating on receptors that are particularly relevant during fetal development, early childhood, and puberty, which are precisely the life stages during which the people most likely to be covered in sunscreen multiple times a week are experiencing. Here is the part of this story that does not make it into most American sunscreen conversations, and it is the detail that reframes everything else. The filter that the EU and many other markets have been using instead of oxybenzone does not have the same absorption profile. Mineral filters, specifically zinc oxide and titanium dioxide in their non-nano formulations, work by sitting on the surface of the skin and physically deflecting UV radiation rather than absorbing it. They do not enter the bloodstream in the way that chemical filters do. They do not have the estrogenic activity profile that peer-reviewed research has associated with oxybenzone. They are available at every store that sells the chemical versions, often at comparable price points, and they are already the standard in most European markets. And in December 2025, the FDA proposed adding a new chemical filter called BEMOTRIZINOL to its approved list, specifically noting that BEMOTRIZINOL demonstrates minimal systemic absorption through the skin and indicates low concern for toxicity, cancer, and reproductive effects. This would be the first new sunscreen active ingredient permitted in the US in over 20 years. Let that land for a second. The FDA proposed approving a new chemical filter specifically because it does not absorb into the bloodstream the way the existing ones do. That proposal is itself a formal acknowledgment that systemic absorption is the problem the agency is trying to solve. In 2025, in a proposed rule, while oxybenzone-containing products continue to fill the shelves at every pharmacy in the country. I want to say something directly because this particular topic has a habit of producing two unhelpful responses in equal measure. One is dismissal. The amounts are tiny, everything causes cancer, correlation is not causation, just enjoy the beach. The other is panic. Never use sunscreen again. The industry is poisoning us. Both of those responses lead to the same bad outcome, just from different directions. Dismissal keeps you applying a chemical with an unresolved safety profile to your children's skin every weekend of the summer, year after year, during the developmental windows where endocrine-disrupting exposure matters most. Panic leads you to skip sun protection entirely, which exposes you to a risk that is not theoretical at all. Skin cancer is the most common cancer in the United States, and UV exposure is its documented cause. The honest position is neither of those. It is this. There is a chemical in the sunscreens currently dominating the American market that the FDA's own research found absorbs into blood above the FDA's own safety threshold, that a growing body of peer-reviewed research associates with estrogenic activity in biological systems, and that has already been replaced in most of the developed world's sunscreen formulations because of exactly these concerns. And there is a direct, available, immediately actionable alternative that avoids this specific problem without sacrificing sun protection. The practical change here is simpler than almost any other swap we have covered in this series. Replace chemical sunscreens containing oxybenzone, avobenzone, homosalate, octosalate, octocrylene, or octinoxate with mineral sunscreens containing zinc oxide or titanium dioxide as the only active ingredient. These are the two filters the FDA has classified as generally recognized as safe. They do not absorb through the skin in the way that chemical filters do. They do not have the estrogenic activity profile that peer-reviewed research has associated with oxybenzone. They are available at every store that sells the chemical versions, often at comparable price points, and they are already the standard in most European markets. One practical note on mineral sunscreens that is worth giving you directly: zinc oxide and titanium dioxide in their non-nano formulations sit on the skin rather than absorbing into it, which means they often leave a white cast on the skin, particularly on darker skin tones. This is the main reason many consumers prefer chemical sunscreens. Several brands have developed tinted mineral formulations that significantly reduce the white cast effect, and these are now widely available and more cosmetically wearable than mineral sunscreens were 5 years ago. The cosmetic inconvenience is real. It is smaller than it used to be, and it is meaningfully smaller than the alternative. For children specifically, the American Academy of Pediatrics already recommends mineral sunscreens as the preferred choice, specifically citing the skin absorption profile of chemical filters. This is not a fringe position. It is current mainstream pediatric guidance, and it has been for several years. Here's the detail that ties this episode to a much larger pattern worth tracking. Oxybenzone has been in American sunscreens since the 1970s. The FDA's framework for evaluating sunscreen safety was last substantially updated in 1999. 25 years passed without a comprehensive reevaluation, during which the scientific understanding of endocrine disruption advanced enormously. The research on oxybenzone's biological activity accumulated across hundreds of independent studies, and the rest of the developed world's regulatory frameworks diverged sharply from the American standard. The December 2025 FDA proposal to add BEMOTRIZINOL, a filter specifically chosen because it does not absorb into the blood, is the most explicit regulatory signal yet that the agency understands the current framework has a problem. It is also structurally an acknowledgment that the solution has existed for years in markets outside the United States, that it works, and that it was simply not available here because the regulatory pathway to approve it took 2 decades to navigate. You do not have to wait for that process to finish. The mineral alternatives that do not carry this absorption profile are on the shelf right now. The information needed to choose them is in this video. The switch takes 30 seconds at the store. It is a Saturday morning in July again. Same beach, same pool, same park, same child running toward the water. You reach for a different bottle now. The label says zinc oxide. The active ingredient list is 2 words instead of 12. You rub the same white line into the same small shoulders, and they run off into the same sun. The protection is the same. The UV is blocked. The skin cancer risk is addressed. The only thing that is different is the mechanism, and the mechanism is the entire point. Every swap in this series has looked like this. The same function, the same convenience, the same outcome, minus the specific documented concern. You now have one more of them. Keep them, use them, and send this to someone who is still reaching for the other bottle. If you want the next one, subscribing is how you get it. I will see you in the next